Well, let me just start off by saying I think seniors deserve the best possible care regardless of where they live in the country, which is rooted with respect and dignity. That's why both Minister Duclos and I welcome the standards that came out and released by Health Standards Organization and CSA. And I do want to take a moment just to recognize the extensive amount of work that they've done in terms of consultations with Canadians, with seniors serving organizations, with seniors themselves, and of course, people on the ground and those. And I truly think, I think these standards are going to make a true difference and improve and set the bar high in terms of the quality of care for seniors.
We are working on all types of healthcare to Canadians and to workers, including long-term care, which is obviously very important post-COVID-19. Workers have suffered and patients have suffered enormously. So it's complementary. It's not the only piece of the healthcare conversation. No, this is good news because it's going to help patients and workers live and work in a safer place. And we know that comes with better work conditions for long-term care workers, better physical infrastructure, and better standards to which we can work with, in part, as Minister Khera said, the $3 billion investment that we've announced in 2021. Now we are looking forward to sign agreements with provinces and territories to see how they can use those dollars to further meet these new standards.
Well, I don't think you can have safe long-term care if you don't have meaningful standards that are enforced. That's the message from the reports today. I think it's what every Canadian understands. You know, if you only have one care aide for every 100 patients, we don't have to be an expert in this area to know that those residents are not going to be getting the care they need. They're not going to be bathed enough. They're not going to be cared for enough. They're not going to have their medication monitored properly. They're not going to be fed properly. So we need to make sure that there's adequate, for instance, staff-patient ratios. We need to make sure that there's minimum standards of care for every patient that's commensurate with their needs. We need to make sure that long-term care homes are meeting the standards that are set in legislation, the minimum standards. And, that's, I think, what long-term care legislation requires. And if it's going to be safe, then those standards have to be in the legislation.